Hi everyone, thank you for watching my video. Today I'll be talking about graduate nurse development during moral distress for my management and leadership project. So what is moral distress? Moral distress is the distress felt by an individual due to the inability to perform the right action despite knowing the right action. This can be due to regulations, restrictions, policy, patient preference, patient religion, basically anything that makes you feel uneasy that you're not doing the right thing. It is not uncommon in the nursing profession and represents some of the main reasons for burnout and fatigue. However, newly graduated nurses, or our NGNs, are especially susceptible to moral distress because of our inexperience in the profession. And we can feel this for a number of reasons: conflict regarding the nursing code of ethics, organization policy, protocol, or again, personal beliefs. So my objectives of the slideshow today are to raise awareness about moral distress, emphasize strategies that proper support NGNs from being a student in our safe little nursing school bubble or the transition to a practicing nurse with the mentorship or transition programs. Examine the causes, effects, and consequences of moral distress on NGNs, and how moral distress jeopardizes patient safety, care quality, teamwork, and workplace culture. And also dissect the role of leadership and workplace culture in supporting NGNs. So my safety implications are poor teamwork, poor workplace culture, ineffective leadership, and limited or no mentorship opportunities, and then compromised clinical judgment. So moral distress kind of causes poor teamwork, and poor teamwork causes moral distress. So they do kind of go hand in hand there. Poor workplace culture can exacerbate moral distress for sure. Ineffective leadership, again, can either be caused or exacerbate moral distress. Limited or no mentorship opportunities. So when nurses are having complex feelings and unsure how to navigate it or navigate complex patients, complex care, no one's really leading them or showing them how to do that. And then when a nurse is experiencing moral distress, it does compromise clinical judgment. So poor teamwork contributes to the intensity of moral distress, and nurses under moral distress are more likely to experience powerlessness, self-blame, guilt, and poses a really high risk to quality of patient care, patient safety, and has a really high turnover rate. What I found very interesting during my research was I found a study of specifically nursing students, along with some physiotherapy students, who had their clinicals interrupted by the first wave of COVID in March of 2020. And they did a study of what was the most distressing or upsetting thing, and it wasn't the heartbreak or the absolute horror, essentially, that was the COVID-19 pandemic. It was poor teamwork. So students reported feeling unprepared and unsupported in clinical environments, and in addition to, these problems that they were having were exacerbated by hierarchical structures with physicians, feeling like they could not influence the course of events, feeling silenced, abandonment from instructors, lack of shared decision making, and lack of nursing staff even aware that there were students. So this unsupportive environment just really goes to show and really illustrates that a team is a fundamental determinant of emotional and moral well-being, even before we're licensed to practice on our own. Nursing students are a part of the care plan. They are a part of the team. And even though these students, I'm not sure what unit they were specifically, but the fact that they didn't say, oh, seeing people in horrible conditions and super sick wasn't the worst part of what I had to do today, and it was this team caused me the most stress and the most grief. It significantly contributes to the intensity of moral distress, especially for nurses earlier in our career. And when the communication and collaboration is fragmented, and colleagues fail to support one another, it's not uncommon for nurses to also be facing ethical or workload related challenges without resources and without extra help to address them appropriately. So, poor workplace culture, a culture dominated by measurement of compliance, so an organizational focus to audits, checklists, performance metrics as the primary indicator of success, may make nurses feel like they have to prioritize that instead of their ethical obligations and professional values. It is further exacerbated and aggravated by negative workplace environments, and these behaviors do take away from the safety, the psychological safety and well-being of the nurse, and also can damage professional relationships, along with creating workplaces that nurses feel intimidated or unseen and unsupported. So building a culture of peer support and sharing positive feedback really validates your team and validates your coworkers, and can increase staff retention as well, so that the culture centered on peer support and positive reinforcement is what shines through. When nurses consistently share positive feedback and celebrate team accomplishments and acknowledge each other and appreciate each other and foster a sense of belonging, purpose, and fulfillment, these are the nurses that are going to want to stay and going to want to work. So department culture is heavily impacted by leadership and the approach of the leader. They set the tone for how the department or unit or wherever you're working is ran. When leadership is inconsistent, unsupportive, disengaged, cultural patterns that are negative can take place. This could be poor teamwork, incivility, mistrust, creating a fear almost within the unit. However, leaders who model respect, foster that positive culture, use open communication, are transparent, and treat everybody with fairness and civility, allow the nurses, the new graduate nurses, our NGNs, to speak up and ask questions, raise concern, and it is a safer place to be when there is effective leadership, because then you're not left alone, you're not afraid to speak up, you're not afraid to voice your concerns, and also these leaders and managers have the ability to manage workload and resources, where someone's not super overwhelmed over here while this person has nothing going on over there, and getting those resources that their staff needs to be successful and provide safe care. So, mentorship opportunities. The implementation of a graduate nurse training program allows for NGNs to gain experience while being in a safe environment, and also helps them to integrate theoretical knowledge with real-world practice. Through this ongoing process, there's education, mentorship, and feedback. NGNs gain the competence and assurance needed to provide safe and effective care, also while strengthening their professional identity, which is what we need. So the nurses that go through there was a 3-month study done at a magnet designated hospital, so a very powerful hospital, reported that both mentors and mentees experienced improved job satisfaction and reduced the cost of NGN turnover. So we're retaining our nurses. They want to stay and they want to work. This gives them time to create meaningful connections with their preceptors and their mentees. Find a meaningful place within the professional team, and reduces feelings of uncertainty and empowers the NGNs to be able to adapt more quickly to the demands of a real clinical practice rather than just being a student and play nurse. These programs are also becoming like the gold standard in Western Australia, as many hospitals are moving towards that way of training their grad nurses and getting them on board. So compromised clinical judgment is my last safety bit. NGNs are expected to safely perform clinical skills just as a seasoned nurse would, but evidence shows that NGNs experiencing institutional constraints, moral uncertainty, and moral conflict lack moral attention, and lack of moral attention can hinder the ability of NGNs to exercise effective clinical judgment. So this could be resulting in, a near-miss event, wrong medication administration, just things like that we try to avoid at all costs. No one's perfect. We're going to make mistakes, but when our minds are preoccupied is when the risk of something dangerous happening to our patient increases exponentially. 17% of NGNs leave within the first year of employment, which is the result of moral distress, resulting in high turnover rates. So this would be like 4 of our classmates not being in the nursing profession after a year anymore. And this is because of moral distress and because we don't sometimes always have those resources that we need to provide the best care for our patients and ourselves. So my solution to this is implementation of a graduate nurse training program as they integrate ethical education, structured mentorship, supportive leadership, and psychological safety to help NGNs navigate the moral distress that comes along with nursing. So the financial review of this program is it costs approximately $4,000 for 18 mentor and mentee pairs for the graduate nurse training program. Reported satisfaction was 69.5%, and everyone remained employed 3 months post-implementation, which saved the organization almost $500,000 in turnover loss. I think that this just speaks volumes to how effective these types of programs are and how much we need programs like this to keep our grad nurses safe and provide the safest care and retain our staff and keep our nurses in the profession for longer than a year. So for my nursing meta paradigm, for the person, NGNs should be viewed as individuals with unique values, vulnerabilities, and be acknowledged that they need structural, emotional, cognitive, and ethical support as NGNs navigate new and unfamiliar responsibilities as a new RN and complex care situations that they might not have been exposed to in nursing school. By viewing our NGNs holistically as a whole person, like we would our patients, organizations can tailor guidance, mentorship, and feedback that build confidence while already honoring what that nurse brings to the table. And also you learn what that nurse needs. You learn what they need from their preceptor, from the organizational standpoint, and just supports their development professionally and personally. The environment, putting these nurses in an environment that is safe. When they feel safe to ask questions, seek help, express concerns, they are more likely to engage in reflective learning and develop strong clinical judgment. The strengths of this program, by creating intentional spaces where newly graduated nurses, they're protected from judgment and empowered to learn from challenges and their struggles, but they're not faced to do it alone. And they're encouraged to participate fully as growing members of the healthcare team, where as a student, that's not necessarily your role just yet. On the health aspect, moral distress affects emotional and physical well-being. Prolonged exposure or prolonged durations of moral distress without adequate support can lead to horrible symptoms like sleeplessness, anxiety, fatigue, disturbances in sleep, emotional exhaustion, and this is what brings a nurse to burnout and compassion fatigue, and also can cause early career departure. Through early identification, though, we can prevent this from happening. Working very closely with your mentorship or your preceptor, they can help to alleviate these problems, and that's why these training programs exist. They reinforce foundational learning values by encouraging moral reflection, professional accountability, and self-advocacy. So the nursing process of moral distress detection includes evaluating the source of distress, such as ethically complex situations, high patient acuity, conflicting expectations of patients or coworkers. Assessment should address these gaps, ensure that the nurse feels safe, and any communication or team interaction barriers that the NGNs may experience. Leadership support deficits such as lack of feedback or inaccessible supervisors, inconsistent preceptorship as well, should also be taken into consideration. I know for myself that when I go to clinical and it stresses me out when I have to, say, oh, I'm with you today, and some of the nurses are so excited, and other times like, oh, I have a student. So, things like that can also bring about moral distress as well. So diagnosis, identifying, and prioritizing issues causing moral distress. So again, voicing those concerns, bringing those concerns up to your supervisor, things like that. Planning and developing an individualized plan. So what works for me might not work for somebody else, and vice versa. So it's important to think of this as your own care plan, essentially. And this can be done through scheduled check-ins, scheduled briefings, anything like that works for that nurse. Implementing your plan is important to talk about the situation, ethical dilemmas that you might be facing. Another thing that I found that I thought was interesting was doing simulations, low fidelity simulations, just so when you see it in real life, it's not the first time that you have seen it or talked about the topic or done the skill or had a high acuity patient. And then monitoring their progress with this success plan in place is critical as well. So for my theory, I thought it would be only fitting to choose Jean Watson's theory of human caring. She emphasized the caring presence and authenticity, which is what NGNs need when they're experiencing this moral distress. It ensures that mentors, preceptors, educators, and leaders approach NGNs with compassion, empathy, and respect, just as they would a more senior or more experienced nurse. The human-centered aspect, I think, was also very important in this theory when talking about moral distress, because it facilitates trust, safe expression, and meaningful reflection, and all while giving NGNs the ability to develop resilience and ethical competence as well. And it just reinforces the importance of self-care, emotional support, and preserves NGN dignity while addressing moral distress. So over the course of this semester, my clinical group and I have been working with the Lewin's change theory, which has 3 sections in it: the unfreeze, change, and then refreeze phase. So unfreeze raises awareness of NGN distress. You can present data to leadership, whether it's through surveys or interviews, things like that. Acknowledge gaps in NGN support. So where are our new nurses not feeling supported? Where are they feeling supported? What can we improve on? What doesn't need to be worked on right away? This helps support that professional transition and also challenging existing cultural norms. I know that there's a saying called nurses eat their young. I personally haven't experienced that, but I feel like that we are doing a good job of getting rid of that saying, because I don't like it, but I feel like some nurses are very accepting of students and want us to succeed and want us to do well in the profession, and that's exactly what these graduate nurse training programs are for. So introducing the graduate nurse, the GNTP, would be the change. It would involve ethical training, communication workshops, interdisciplinary collaboration, budget expansion, role reassignment, and initiate debriefing processes after traumatic events for anyone involved, not just the graduate nurse. So now this is going to be our new status quo. Set the program for permanent orientation, any new graduate nurse. Study our annual competencies, review leadership expectations, and from a management perspective, celebrate the success of your unit, of your new grads, of your seasoned nurses, of your long-time workers. Provide resources and reinforce a culture of safety, ethical awareness, and leadership as well. So my leadership theory I chose is transformational leadership. I feel like when new graduate nurses observe leaders engaging constructively and positively with staff, addressing conflicts transparently, and fostering a culture of mutual respect, they are more likely, these nurses are going to feel more like secure in their job. And through this guidance, transformational leaders do play a key role in developing resilient and confident NGNs by offering encouragement, recognizing their strengths, and facilitating opportunities for growth. They help NGNs both emotionally and professionally develop the capacity to manage challenges and maintain their moral integrity. So they are a role model for the unit. And when our NGNs see this, they feel safe. Over time, this resilience not only enhances individual well-being, but also is contributed to stronger patient outcomes, better teamwork, and a more stable workforce, more stable nursing workforce, more stable department. And these NGNs feel like they have space to grow, and they feel safe at work, and that moral distress is mitigated. So the entry-level nursing roles for mitigating their own moral distress is very critical, that they advocate for themselves, ask questions when tasks seem unclear, not be afraid to make mistakes, participating in ethical decision making, utilizing preceptors or leaders within the team for support, and engage in reflections and debriefing. It's also important that they report their concerns and continue their education in moral stress mitigation, whether that is through their own avenues, such as journaling or anything like that. You are your biggest advocate, and if something isn't going on, you can always ask questions. And I think that a lot of new graduate nurses, I found myself a lot of times over the summer in my own experience, just asking why a lot. And I think that being your own advocate is the most powerful thing you can do to understand the why we're doing this, why we're not doing the other things, why just giving yourself the reason why. So for nursing philosophy and the meta paradigm, I think that nurses should be recognized as whole individuals before they are nurses. They have their own, we all have our own values, beliefs, personal philosophies, emotional needs, but it is especially important when nurses that are new and they're sensing self-doubt, they're feeling vulnerable, they're not sure about ethical decisions, acknowledging them and their concerns that this is real and they're supported and validated, essentially. Cultivating an environment of positive and supportive coworkers is critical for shaping NGN's confidence and resilience. Cultivating this workplace prioritizes open communication, mutual respect, and again, that psychological safety that I've talked about a lot. Again, this just promotes teamwork, sharing knowledge, and encouraging a non-toxic environment to prevent that turnover of staff. And then for health, moral distress is not just emotional, it is physical and can sometimes be very serious to well-being. Recognizing that a healthy nurse is a safe nurse that provides safe care is critical, and systems need to advocate for their graduate nurses to attend the debriefing, to attend the decision-making meetings, reach out to mental health resources if they need it, find that peer support. Early intervention promotes long-term well-being and reduces the risk of burnout or premature departure from the profession. So nursing as a profession is based in ethical care, critical thinking, advocacy, and compassion. So these newly grad nurses heavily rely on the mentorship and effective leadership and strong educational support to develop these essential competencies of nursing. Creating systems that promote continuous learning, continuous feedback, getting that skill development and advocating for themselves, but also for transition programs, accessible preceptors that want students, leadership development, and ongoing professional support even after they're completed with the GNTP is critical so that these nurses can maintain their moral integrity, grow into confident and competent professionals, and uphold the foundational values that is the profession of nursing. Here are my resources, but thank you guys so much for listening and have a good day.